Welcome everyone to our weekly roundtable. I'm here with our head resident, Kylene, and we're going to discuss some cases that we have in the clinic this week. Some of them are difficult, and I think you'll be interested in these for those of you who practice. So Kylene, who's up first?
Okay, we have patient, male, 63 years old, and we've been treating him for a little over a month now. One of his primary concerns is his heart health, in particular his high blood pressure. We've been treating him. He's a very emotional, angry, sort of irritable kind of guy. And through the months, we haven't seen as much improvement with his pulse. And we've tried the heart clearing and also liver fire clearing approaches with him, and we're still not seeing much change with the pulse.
Okay, you're going to find that treating primary hypertension, and these are cases where the person just has high blood pressure with no known etiology. And in Western medicine, they call it primary hypertension, but in Chinese medicine, we can determine what's really causing the problem from pulse diagnosis. And this gentleman's pulse is very, very bad. He has an extreme amount of heat, and it's systemic. It's everywhere. It's in his upper, middle, and lower jiao, especially in the middle jiao. And that's why he gets so angry and upset. And so there's no way you're going to be able to fix this kind of high blood pressure problem unless you strip the heat out. And since he's had this high blood pressure for many years, you will have to spend quite a bit of time stripping the heat out. It's been there. So you can use different approaches. One approach that we used was using quite a bit of Dahuang, which was 15 grams, and then we used San Huang Sheishan Tong, 20 grams, Shixian Sao, 30, and then Zhuifu Zhuyu Tong, 30, some astringents, Hudze, Wubeizi, Tianhua Fen, Baiwei, and Subaya, 25, Dongui Shengma, 10 each. It turns out that didn't drop the blood pressure. So what we're going to do next time with him, we'll give him something to strip the heat out on a more systemic level. And because there's a lot of heat mostly in his liver, we will direct the treatment at the liver. So we will use a method from the Wang Di Ne Jing, which states, I believe in chapter 26, that if there is excess heat in the body, what you have to do is you have to use about the different flavors of herbs that you have to use are salty, sweet, bitter, sour, and then bitter. So in his case, we'll use 40% salty. These will be Zhenju Mu, Si Shi, and we'll use, we won't use Dilong, but we'll use Longu. And we'll use 13 grams each. So 3 times 13 is 39 grams. So about 40% of the formula will be salty herbs aimed at the liver. Then we'll use sweet, bitter herbs, Xuanshen, Shengdi Wang, 15 each. Then we'll use astringents, which are sour, Hudze, Wubeizi, Tianhua Fen, and Baiwei. And that will be 20% of the formula. And then we'll use 10% of the formula will be very bitter. In this case, because he's so ornery, we'll use Long Dan Sao, 10%. And if we give that to him, what will happen is not initially, the blood pressure perhaps won't drop initially, but as the heat's stripped out, over the next few weeks, watch the blood pressure come off.
So a few weeks.
Yeah, it'll take a few weeks. When you see a large amount of heat driving anything in the body, then it's so clear. All you have to do, if you clear that heat, there is no way in hell that man's blood pressure is going to be high. Because his vessels are elastic. If you feel his pulse, they're not hard. He doesn't have arteriosclerosis. What he just has a tremendous amount of heat creating quite an amplitude. So his systolic pressure is going to be high. His diastolic pressure will be high normal. And so all we have to do is drop the systolic pressure, and for that, we'll just use these heat-clearing herbs. We tried the other way, and it didn't work. So now we're just going back, just a straightforward approach of clearing the heat out in the man's body. And so we'll, remember this case, and we'll go through it here in the next, month, and we'll bring it up again. Okay? Thank you very much.